Hi, everyone, and welcome to ED Connections, where we are live and connected. I am Kayla Carson, Regional Director of Clinical Partnerships, and I work for the SELA Eating Disorder Network. Our network is comprised of Magnolia Creek, SELA House, and the Toledo Center for Eating Disorders. We focus to meet clients exactly where they are in their recovery, and we provide the necessary therapeutic techniques to empower sustainable freedom. Our expert clinical teams help clients understand recovery is possible by using individualized treatment plans comprised of a combination of evidence-based treatment modalities. Our goal is to make each client feel safe and close to home by conducting all levels of care in comfortable home-like settings. This is designed to offer a clear step-down process so that clients feel continually supported in their recovery journey. We are excited to be talking about our medical programming at the Toledo Center for Eating Disorders. Toledo Center is located just outside of Toledo, Ohio, and cares for all genders ages 12 and up at the residential and PHP levels of care. Today, I'm really excited to have one of our teammates talk to us about the medical programming at Toledo Center, and it is our Assistant Director of Nursing, Michele Graham. Hi, Michele.
Hi, thanks for having me today, Kayla.
Thank you for being here. So, we have been through a lot in terms of our just overall medical things in the last year in the country. And so, with that said, can you tell us a little bit about the medical programming at Toledo Center and how we've shifted since the pandemic to keep our clients and families safe?
Absolutely. So our medical care team here is responsible for facilitating all aspects of care to improve the patient's mental health. So we work hand in hand with our own provider just to make sure that care is being coordinated and to identify and achieve any problems that the patient may have. We definitely work closely with outside providers to make sure that we're still coordinating care and making sure that we're able to get all of their medical needs while they're still here at the Toledo Center. Since the pandemic has shifted and kind of changed some things for us, we have been seeing a lot of our patients virtually with our providers just to provide that safety so we're not necessarily within a close space. Allowing for that 6 feet of difference, I guess, is what I'm trying to get at. And also, when that's not provided, just making sure that we have implemented the wearing the mask, making sure that we're practicing good hand hygiene. We've been working very closely with our medical director, who is an infectious disease doctor. He has been keeping us very well up to date as far as safe practices, how to make sure that we're safely quarantining someone if we were to become exposed and things of that nature, just so that we're able to keep our clients, their families, our employees, and the community safe. We've gotten our patients extremely involved in the process as well. We've done some fun things such as make masks during groups. We've been practicing where were like actually experimenting last week with germs and how to wash their hands properly. They've also made like all these nice like educational posters that we've hung up around the building to truly get them involved with wearing masks and also making sure that they're practicing good hand hygiene. To keep our staff and people coming into the facility safe, we've also been making sure that we have a temperature scanner at the front door that's able to not only tell them that they are safe to enter the building, but also making sure that they're wearing their mask. So the machine will say, "You're not wearing your mask," which is very nice.
Yeah, wow. So, of course, I'm hearing the overall theme across our network of individualizing care, really coordinating care with our current medical providers. And that coordination is really important because our medical providers know them so well. They've probably known them most of their lives. So when someone's coming into us, we are using that knowledge from their provider to continue their care and just not have any gaps in their needs. And then also just creating this sense of personal accountability when it comes to keeping everyone safe. And I love the creativity that you guys have implemented for our clients in terms of the posters. And I'd love to see some of those posters too. And I have seen the scanners, and they do call you out. They will say, have on your mask, or we need to recheck your temperature. And so just the network at large has implemented these tasks. And I love how Toledo Center specifically has really involved the clients, like you were saying. I got really excited to talk about the medical programming at Toledo Center. And I would love for our viewers to just know a little bit more about you, Michele. So can you tell us a little bit about you and how you decided to care for individuals struggling with eating disorders as your full-time role?
Absolutely. So I started my career off in critical care, worked in trauma and things of that nature, have a certification as a sexual assault nurse examiner. So that's where a lot of my background comes from, actually. With that, there is a mental health piece to taking care and caring for those kind of patients. And so I did fall in love with mental health for that reason. So I kind of had progressed my career as being a crisis nurse, which made me fall in love with mental health even a little bit more, to where it has now, I've been able to progress to where I am back in school to be a nurse practitioner, and it's going to be kind of individualized in psych. So I am very excited to be taking those next steps to kind of move my career as far as working with psych patients. This position kind of didn't know that I would like eating disorders, but when this position became available and I realized how involved this team is in making sure that we help with their recovery, it's very rewarding in that sense. When I worked in critical care, it truly, you never got to see the outcome of your patients that you were helping. So you would do everything that you needed to do to make sure you save that person, but you never really got to see what actually happened and to move forward with that patient's care. Whereas with this eating disorder, and with Toledo Center, I have been able to watch people come in at their worst time and to see them progress through treatment and see them progress to recovering, and to see a patient come in at their most vulnerable time and to see them go through those changes. It's almost like a caterpillar and a butterfly. To see that, it's just been very rewarding, at least for myself.
Yeah, I could see where, as a person who's a helper, right? People who are in nursing, they tend to be helpers, to be able to see the results of that help. And just in the few interactions that we've had so far, Michele, your calming demeanor, and I can tell you're just able to think so quickly on your feet. If I were in crisis, I would want you next to me. And so we're really thankful to have you with our clients when they are struggling. And so many of our clients may be victims of sexual trauma. And for you to have that background is really valuable for our clients and their families. And so if someone is struggling with an eating disorder and needs help, what can you tell them about the Toledo Center Difference?
I would truly say that it is our dedication, our passion, our commitment to making sure that they get well. Our staff here is just so involved with the care and making sure that the patient succeeds. Truly, I don't know, I'm just honestly grateful to just be able to see this process and to see how committed our staff is here. We truly do care. They're so kind and understanding, and we work so well together to make sure that we're providing the best excellent care and just making sure that we're always updating each other on what's going on with the patient, to provide them that individualized care, to provide them with the best services possible while they're here just even during the time, whether it be short or long, to making sure that they get that best treatment plan while they're here.
Yeah, so the teamwork that we see and just the overall respect for each other is so necessary to help clients and families learn and find recovery. And so we're really thankful for the team at Toledo Center. You guys are second to none. And I guess we'll just go on into more information. Michele, thank you so much for taking time, and we're really excited to learn more about you and learn more about the Toledo Center. And if you want to learn more and need more information about our eating disorder network of services, or if you're someone you know is suffering from an eating disorder, we are here and we're ready to help. You can visit our website at www.toledocenter.com. Contact our admissions team 24/7 at 765-641-0022, or private message us on any social media platform, Facebook, Instagram, Pinterest, and LinkedIn. We invite you to join us next week at 12 p.m. Eastern. And from myself, Michele, and the team at Toledo Center, thank you for joining us today. And again, we are here, we are ready to help, and we invite you to walk into freedom with us. Have a great day, everybody.
Thank you. Bye.